So imagine it's your first day as a medical receptionist. The phone rings and the patient wants to schedule an appointment. What do you say? What question should you ask? And how do you make sure you don't make a costly scheduling mistake? In today's video, I will walk you through a real life patient scheduling call, step by step, so you can answer with confidence and sound like a professional. So let's begin. Welcome to Healthcare Skills Hub. My name is Nair, and if you're preparing for a medical receptionist, patient support specialist, or virtual medical assistant role, this channel is designed to help you develop the practical skills employer are looking for. So we'll have a real role play today. So we'll go to scene one. The phone rings. You as a receptionist. Good morning. Thank you for calling ABC Medical Clinic. My name is Sarah. My name is John. How may I help you today? The patient says, "Hi, I would like to schedule an appointment with the doctor." So, excellent. Notice that the receptionist greets the patient professionally, introduced herself or himself, and invited the patient to explain the reason for the call. That creates a positive first impression. So we'll go to scene two. Receptionist, certainly, I would be happy to help. May I have your full name, please? My name is John Smith. My name is Sarah Connor. Thank you, Mr. Smith. Could you please verify your date of birth? These are the patient verification things. We have to ask the patient the full name, the first name and the last name, the date of birth, sometimes the phone number as well, if applicable. Patient says, July 18th, 1991. Always verify the patient identity before accessing or discussing the appointment information. That is an important part of protecting the patient's privacy. Scene number three. Receptionist, may I ask the reason for your appointment today? I have been having severe headaches for the last 3 days. You have to answer softly. Thank you for letting me know. Knowing the reason for the visit helps schedule the patient with the correct healthcare provider, the doctor, and allows the clinic to allocate enough appointment time. You cannot schedule a diabetic patient with a pulmonologist, so always you have to ask the reason for the call to schedule an appointment. See, number four, please allow me a moment while I check the doctor's schedule. You're putting the patient on a hold. You're returning after a few moments or few seconds. You'll start with, "Thank you for waiting. Dr. Smith has an appointment tomorrow at 9 a.m. or Thursday at 4 p.m. Which appointment would you prefer?" The patient has their own timings for the appointment. They have their own availabilities. Tomorrow morning would be great. You can offer more than one appointment whenever possible. That is according to the provider's schedule. This gives patients flexibility and improves their overall experience with you. Let's go to scene number five. Wonderful. I have scheduled your appointment for Wednesday at 9:30 a.m. with Dr. Smith. Please arrive 15 minutes early and bring your photo ID and insurance card. Patient says, "Thank you very much." You're welcome. Is there anything else I can help you with today? No, that's all. The receptionist says, thank you for calling ABC Medical Clinic. Have a wonderful day ahead. Now, uh, I'm going to give you some tips that every medical receptionist should remember. Always verify the patient's identity. Repeat the appointment details before ending the call. Like you have to give a recall of the patient's appointment. So I'm going to give you a quick recap on your appointment, which is now scheduled for this day at this time with Dr. Smith or which Dr. Johnson or Dr. Sarah. So end every conversation politely and professionally, giving a recap. While giving a recap, the patient memorizes the appointment details. There are also some common mistakes we all do. Like, as I said, that you cannot schedule a diabetic patient with a pulmonologist, oncologist. So, booking the wrong provider, wrong appointment time, forgetting patient's instructions, speaking too quickly. Like, okay, I have scheduled your appointment with Dr. Smith Monday, August 3rd at 9 a.m. in the morning. Sounds unprofessional. So I'm going to give you a quick recap. I have scheduled your appointment with Dr. Smith on Monday, August the 3rd at 9 a.m. in the morning. So this is one of the most common mistakes a medical receptionist do while not repeating the appointment details. So what information should you always verify before scheduling an appointment? Full name, date of birth, phone number if applicable. You just completed a real patient appointment scheduling scenario. The more you practice conversations like this, the more confident you will become in interviews and on the job. I always tell my trainees, my viewers, that you can stand in front of a mirror, practice the conversation. Like, thank you for calling ABC Medical Clinic. How may I assist you today? How may I help you today? So, after some time, you'll be more confident with the conversation. You'll be more confident with the sentences. There are that's a repetitive sentences we always use in everyday conversation with the patients. So, the more practice conversation, the more you practice conversation, the more confident you will become. If this video helped you, please like, subscribe, and share it with someone preparing for the healthcare career. Thank you for watching Healthcare Skill Hub. I will see you in the next lesson.